I was first inspired to go into medicine by my mom, who's a nurse, and I always thought what she did was really cool. And so when I went to med school, I didn't know what I wanted to do, and then I kind of stumbled upon orthopedic surgery and loved that you could solve problems and help people and really have a practical impact on people's lives. So when I saw joint replacement surgery, I felt like that was quintessential orthopedics, getting people their mobility back. Whether it's getting back to hiking or fishing or playing with your grandkids or, golfing, whatever it is that brings you joy and brings meaning to your life. Once you lose your mobility, a lot of that is really hard to do. And so for me, for hip and knee replacement, it is getting people back to doing those things that they love to do, that I love to do too. And so I really empathize a lot when people lose that and look forward to helping them get back to it. I've been telling patients in clinic, you can do really good surgery without a robot, but the robot is a really amazing tool for us to use to make surgery as precise as possible and help us do surgical planning before we have to make any actual cuts inside the human body. And so robots make us more precise and I think make us better surgeons when they're used correctly. I want my patients to know that everyone who comes into clinic, I try to treat like one of my own family members. I try to give them the advice that I would give my mom or my dad or my sibling. And I think that there's a lot of power and honesty in medicine. And so I try to always tell people what I think is possible for them and what we can do for them. I'm Dr. Alex Lancaster, and I'm a hip and knee replacement surgeon at the center.